Hi, and welcome to the Completely Me podcast, episode 2. We're here with the wonderful, amazing Dr. Lindsay Gracey, who is an audiologist and my personal favorite audiologist and a good friend who we have actually met years ago because of my hearing issues. And the second that we met, we fell in love. We really became friends right away, and it was because she goes above and beyond for her patients, and she was the first person, which is very interesting to me, that talked to me about hearing aids and how life-changing it really can be. So today we're going to do something really special. We are not only going to have some Q&A, but we're going to have a real live hearing aid appointment. I was due for it. I started having some issues and I call her up and I'm like, come on down, let's do this in person. So thank you so much for coming today.
Thank you so much for having me. And that was just such a nice intro. Very
I mean it all.
sweet,
I
over
really
the
do.
top, but I love it. But I'm so happy to be here. And this is just such a fun opportunity to do a live appointment and just get to kind of nerd out a little bit with you.
I love to nerd out. It's one of my favorite things. So I wanted to give you a second to talk about your own practice
Sure.
before we get started.
Awesome. Well, I have been in private practice for about a year. It's been a year, officially a year.
That's crazy.
Yeah, so
Time
it's
flies.
been my history in audiology has been in ENT mostly. My entire career, I went to University of Florida to get my doctorate. So for audiology, you go to school, you get your undergraduate, and then you go 4 years for your doctorate, and then you do a year of residency. So my year of residency was in ENT down in Weston. And to me, I mean, I'm a little biased, but I love the ENT experience. And I really feel like that set me up to see all of the weird cases, to see all of the medical types of hearing loss, the different types of management, from newborns to 112-year-olds. I mean, it's a good background for me to get. So I spent 8 years in ENT and decided to take the leap of faith to open my own practice. So Wave Audiology was born.
Go check her out.
Yes, it's just me right there for now, and I have an amazing audiology assistant. Shout out to Carly. And we're growing every day. We're trying to get the word out, and honestly, it's been so great to be the sole practitioner, but also see the business side of it. I mean, getting to do the ins and outs of marketing and accounting, and so it's just. And I often tell people, it's wrecked me because I feel like I can never go back and work for anybody else. So it's
You
nice to
shouldn't,
be.
because honestly, I have seen audiologists my entire life. From the moment I was born, I've been seeing audiologists. And you were really the first person who saw me as an individual and not just
Aw.
a patient on paper. And you have gone above and beyond in every aspect. So I tried to see a different doctor when she moved away, and I immediately cried to my husband that night, and I'm like, you know what? You drive for the best when it comes to healthcare, and I am going to drive. And we scheduled a time that would also allow us to have lunch together
Yes.
afterwards and
Priorities.
chat. Priorities. We had to make a day of it.
Yep.
And it was wonderful. And I got to meet your mom.
Yes. And that
She's
was
the
my
best.
mom was I mean, literally, if you had anybody that you trusted more than your mom working for you, I mean, she really helped me get the business up and going, when we were just getting started. So she was a valuable
welcoming.
asset.
Wave Audiology is where it's at. So let's get started on my hearing aid appointment. You are officially getting a view of what it would look like if I went into her office for this. So I have right now the Starkey Cross Technology hearing aid, which I explained in my first podcast episode, that one is the receiver and one is basically a microphone. And we tried so many different techniques. It was really a trial and error process because nothing was hanging on to this ear.
Yeah, it was. And that's where the cross is such a beautiful invention. And for people like you who have a unilateral hearing loss where, one ear is completely normal or one ear may be better than the other, but the other ear, you could have atresia, you could have microtia. Atresia would be the absence of an ear canal. Microtia is the absence of the outer ear. So either one of those, the cross is a great candidate. You could have someone with what we would consider a dead ear, where they're just completely deaf on one side. A traditional hearing aid wouldn't help. So they invented the cross for these types of people. And Phonak was the first company that came out with it. And that was huge in the world of audiology. So over time, they've been developed, they've gotten better, more accurate. And with the cross, not only are you able to hear sound from that side, so I'll describe to patients that, if your spouse or your kids come up and they whisper in your bad ear, you hear it as if they're whispering in your good ear, which
is so crazy. I remember I literally cried in your office.
I was going to take note of that because it was such, in audiology, I mean, you see the videos of like the patient experiences where everybody in the room is crying, and it's not always like that. So when it does happen, you always take note of it. And I remember so vividly, you're fitting, your mom was with you. And when you put it on, it was so emotional. And it was like, you
literally whispered behind me where I couldn't read your lips. I couldn't see you, but I heard you. And that it blew us away. I never, ever thought that would be possible.
Yeah. And just seeing it, like, even through your mom's eyes, I mean, she was there your whole life. She saw the entire journey that you've been on, the struggles that you had, the challenges, and to see this, just one invention that really makes a big difference. So you get sound awareness. You also have improved localization of sound. Where sound is coming from is a big part of.
I'm so bad at that game. Where is the sound?
2 years are really critical for that because we use when the sound wave hits the head from one side and then there's a delay to the other. Even if we're talking about microseconds, that's how our brain knows where it's coming from.
I had no idea how that works.
Well,
that makes sense. Like the sound hits one side before it hits the other. So you're like, oh, that way.
Now, not to go completely nerd, but whenever we hear like sirens, for example, that's why they're a little bit harder, even for people with normal hearing in both ears, to localize where it's coming from because it's a very high-pitched sound. So the sound waves are very tight. So it's hard to know where the direction is. Whereas if it's a low-pitched sound, longer, bigger sound waves, we're going to have a better idea of where it's coming from.
This is so interesting already.
I love it. But that's why the cross is so amazing because it gives you that localization awareness, also better hearing in the presence of background noise. So, hearing aids and cross devices, they've come a long way. They're not perfect. I mean, everybody's chasing normal hearing. But they've gotten a lot better in the last, 5 or 6 years in terms of getting people more access to sound.
And I really love that you could adjust. You have an app that goes with your hearing aids. And if you're in a loud restaurant, or let's say there was one time where my dad, who has some issues with his vocal cords, where his voice is not very loud sometimes, he decided to sit on my bad side. So I literally put my left ear hearing aid all the way up so it could detect anything he may say to me. But it's nice that I could be like, oh, the person on my left is going to have a low volume. Let me adjust.
Yeah.
That's cool.
The invention of Bluetooth has been a game changer because you do have the access to the apps to control in your own environment. So when we do fittings and you come to my office or I come to your environment, I mean, even this place it's unrealistic in terms of listening environment. The real world is very different. You have bigger open spaces, a lot of background noise, challenging listening environment. So if you can be in the place and make your own adjustments in your own settings, I mean, that's where the patients really shine. That's where they feel like they have more control. And that's a huge thing. It gives patients more confidence.
It's very cool. It's really nice. I do love them, but I do also have some issues. And it's one of those things where you do have to get a checkup. You have to adjust every how often?
We do every 4 months is like a typical follow-up for me. I like to see my patients, 3 or 4 times a year. And that's kind of why I really love what I do, because it's not like your primary care, your dentist, where you see them once or twice. I see my patients multiple times throughout the year. So you really get to know their struggles. You get to know their pain points, where they're succeeding, where they're failing. And you build that rapport with patients. You build a relationship on their journey. Because once you're in hearing aids, you're really not coming out of it. So it's a lifelong commitment. And a lifelong relationship with your audiologist. So every
Lucky
4 months, I know, every 4 months we get to clean and check the devices, which is what we'll do today, and then also make any adjustments, because sometimes you're in scenarios where you're wishing you had more treble, more bass, less volume, more noise block, and those are things that we can adjust in the hearing aids, which is nice.
I just wanted to say that we really had a hard time figuring out what to do and how to get that hearing aid onto my left side. I felt like as soon as we had that amazing appointment where we all were crying and I heard you, then the hearing aid like fell off like that day in a parking lot and I freaked out. And then we went to the company itself, I'm pretty sure,
Yep.
to try to get a mold created to potentially hold it on the inside.
Yeah.
But there's no, what is that part called? The piece that comes, this one.
So that's the tragus.
The tragus is non-existent on my left side. And that's this little piece.
And that's important to the molds. I mean, that's really what holds
Yes.
the tragus and your concha. So the concha bowl, the bowl part of the ear.
Which I don't really have.
Correct.
So we could not figure it out. And that's when you were like, well, you could use glue, like wig glue or something like that. And then you were saying that we could do a headband or we could figure it out. But there was a point in time where I was exposed to the hearing aids and then I couldn't use it. Yep. Until we figured it out.
And that was, the fitting appointments are usually the most glamorous because that's where, the hearing changes. And then you take it home and you are around, especially with you, Justine, you've got, at the time you had one baby. And it's a challenge because they're always holding onto your hair and your ears and your jewelry and
pulling everything.
Yes, they're demanding your attention. You're doing a lot of bending and standing. And that's where the issues come in of retention. How is it staying in your ear? And I think we started with a hook just over the top.
We did, and it was literally just like we tried to hook it, but the issue is it couldn't hang back here.
There was nothing to hold on to.
Nothing.
So we did, I can't remember how many molds we did.
We did so many molds, so many pictures. You connected to like every person that you possibly could, which is one of the reasons why I said that she went above and beyond, is because if one person came back and they're like, we don't know what to do, she would come back to me, tell me about it, try someone else. It was like months that we were figuring it out. And finally, we figured out good old-fashioned tape.
Well, I have to give you the shout out for that because you are the one that discovered that. Because, wig tape has kind of been a way that we can stick processors to the skin, but fashion tape. And you came in and you brought me like a sample, which I ended up giving to patients who wear the cross, actually. Because the cross, the side, the part of the microphone, it doesn't have to sit on the ear. It just needs to be on that side of your head in order for us to get kind of that localization. But in terms of how it sticks to the head, it doesn't have to be in the ear at all. As close to the ear as possible so that we get more symmetry and balance that way. But again, we can get creative. So Justine is the one that found the fashion tape. So shout out, because that's, again, I feel fortunate because that makes me a better practitioner in learning what works well for patients, because I can't go home and wear the cross. That's an experience that you have. So every day you're living with this. You're the mom who's active and busy and moving a lot. So what works for you, I find a lot of value in, because then I can share that with other patients.
Well, I'm happy to help. It is really, it sticks all day, even when you're sweating, which is really nice.
Yeah. We should have done we should have patented it with like the Justine cross tape.
Would have been a good idea. Patent pending.
That's right. But it was really effective. So, we did a lot of molds, but ultimately the fashion tape is really what worked best and what continues to work well for you. So right now I've got both of your devices. The one that has the wire coming out is obviously the one that's going to go in your right ear, your better ear. Now this is a cross system. They also have something called a bicross. So if you had hearing loss in your right ear, we would actually program this to be a traditional hearing aid as well as receiving the information from your bad side. So
they could do both.
They could do both. Over time, as your hearing gets worse in the next, 30 or 40 years, that will be what the purpose of the right ear is for, because that's the one that's doing the listening for both ears. And if that one has a hearing loss, we'll be able to compensate for that too.
That's really cool.
Yeah, it's awesome. When people think of hearing aids, they're picturing these like big bubble gum in the ears or huge whistling devices. And that's just, a thing of the past at this point. I mean, they're small, they're discreet. You could be bald and patients wouldn't see that you have a hearing aid. People aren't looking for hearing aids. I mean, I'm looking for hearing aids because that's what I do. But most people are not. I mean, it's truly become a more invisible
device. And the black,
device.
we really tried to match my hair, and people don't notice it.
It blends really great. So I'm going to give you your cross, and you have your tape.
I do. It's right here. Let's put it on. And while we're testing this, I'm just going to put my garbage right there. But while we're testing this, I wanted to tell you that this is a funny story, but we're having a little feud with our backyard neighbor.
Oh no.
Shocking, right? And who wouldn't get along with us? But a little feud. And we thought, well, Todd thought that they were pointing something with a high frequency sound towards our backyard, which literally I could not hear.
Oh wow.
He said it was so bothersome, so loud, and I couldn't even notice it. I did not notice it, didn't hear it, nothing. But when I would go outside, I would just get kind of a headache.
Weird.
So weird. So there are literally like frequencies out there that I'm not picking up.
Yeah.
And I thought that was really interesting.
Yeah, and that's it's funny because the first I had really looked at some of that, it was an embassy, I believe it was in Cuba, where there were people from the embassy, US citizens coming back who were having headaches and ringing in the ears, and they were sick, they were nauseous, they were vomiting, and all of these symptoms they attributed to some sort of terrorist, like high frequency attack. And it's like, we don't know really the effects of high frequency tones that aren't audible, okay? But they have an effect on our system, on our brain, on our ears, on our body.
See, Todd could hear it. We even had security guards come over and hear it. They heard it. It ended up being just like a really old AC unit.
And it was just like making that high-pitched whirl.
But I could not hear it.
So
I didn't think I was like, Todd, you're thinking about that. Like, you're making that
Well, the
up.
first thing I was going to say is he has tinnitus. Like, what?
What's wrong? Exactly. But he was right. And I was not picking it up. And I thought that maybe it's my hearing's getting worse. But you were showing me on a graph, which maybe you could turn and show to the camera, that my hearing is like way below where it should be.
So when we look at like our setup with the hearing aids, so when we connect them, you'll see one side's blank. That's your cross side, okay? Because we know that that side's really just doing all of the listening. So your good ear, these three lines there, that's where the hearing aid is amplifying soft, medium, and loud sounds. And then your dotted line up here is kind of the max output. So the loudest the hearing aid would go at a safe limit. So some people think, oh, if I hear a loud sound when I'm wearing my hearing aids, will it cause damage? No, there's a maximum output in the hearing aids at a safe listening level. Sounds that you can hear without the hearing aids, like a siren or alarms, that's going to come through without any amplification. So you've got a big space, if you'll see in between here, between what the hearing aid is doing and what it's capable of.
Yeah.
And this is even set for normal hearing in your right ear. So it just does, in terms of how we look at the longevity of your hearing in the right side. I mean, you have a long ways to go before we're really even going to turn on amplification on that side. But we want to watch it because that is your good ear, and we want that to stay as healthy as we can. And the more we stimulate it, the healthier it will stay. Your auditory nerve will stay healthy.
That's interesting. Because when I originally went to go get a hearing aid, my husband was nervous that I would become very reliant on it, that my hearing would get worse without it.
And a lot of patients, that's a very common patient experience. People will call me and they'll say, I don't want to get hearing aids because I don't want to be dependent upon it. And I look at it like glasses. So when your eyesight starts to go, you do not hesitate to get glasses. And that's kind of an accepted thing. We do become, somewhat reliant upon the glasses. Hearing aids are very different. So the reason that we feel like our hearing is getting worse when we use hearing aids is because the contrast. So if you were to go live in a cave for a week and you stepped out into the sun, it would be blinding to you.
Yeah.
But then your eyes adjust. It's not that the sun is any brighter. It's just you've been in the dark for so long. So
That's a good analogy.
Thank you. I use analogies a lot, and I compare hearing to cars a lot too, so that I hope I don't bring up a car analogy. But when we wear hearing aids, because you've had, hearing, and for you, it was your entire life, hearing loss your whole life, and then we put a hearing aid on or amplification through a cross, you're now having access to sound that you didn't before. And the brain craves sensory input. So when we take it away, the brain kind of freaks out a little bit. It's like, whoa.
And that's why I was getting the tinnitus.
Correct. It's just, and we'll talk about that with tinnitus and why we have tinnitus with hearing loss, why it comes and goes with hearing aids, because there is a direct relationship between hearing and tinnitus for sure. But that's the contrast. But I would argue it's better to give the brain the sensory input than to deny it. And there's been a ton of research that's come out from Johns Hopkins. There are a lot of major universities, MIT, looking at the effects of hearing loss on the brain. So they were doing functional MRIs to look at what parts of the brain light up when we hear sound. People who are deaf, capital D deaf, when there is a sound stimulation or visual stimulation, their occipital lobe lights up. Their auditory cortex is staying dark. For somebody with a hearing loss, the occipital lobe and auditory cortex light up together. For someone with normal hearing, just the auditory cortex lit up.
Really?
Now, they found that someone with even a mild hearing loss, if they start using hearing aids, it remaps and only the auditory cortex lights up again. So the brain is plastic. It's always changing, which is a good thing because that's how we get better. That's how we improve the brain function. We know that an overworked brain breaks down faster. So the way that we keep our brain healthy with someone with hearing loss is to stimulate it with a hearing aid.
That's really interesting. I remember you were telling me a long, long time ago that older people, like elderly people, that getting hearing aids helps them kind of turn things back on.
Yes. There is, and this is something we had suspected in the industry for a long time, but we didn't have the data to prove it. Now we do. Hearing aid use, it leads to a slowing of the progression of Alzheimer's and dementia for patients. So
that's amazing.
It's incredible. I would argue that, and I'm biased again, but I would argue that this is one of the most significant findings in this decade because we're able to now see ways that we can slow these neurologic disorders that we don't have cures for. Smoking cessation's another big one. Depression, isolation, and hearing loss. Those are connected. So when you have a hearing loss unaided, you can become depressed. You can become socially isolated. You disengage socially.
Yes.
So when you get hearing aids, you have more confidence. You're engaging socially.
Yes.
You're less depressed. You're going out more. And
you're more connected to your surroundings and to the people. Yeah. And I used to hate, I still don't love, loud restaurants with a lot of background noise. Gives me so much anxiety. And like now I could adjust. I know what to do. It really did give me a lot more confidence.
It's manageable.
It is.
Yep. And those three things can improve just by using hearing aids. So, and that keeps dementia and Alzheimer's at bay or slows it down for people that have a diagnosis.
That's really cool news.
It's amazing. It's amazing. I mean, hearing has such an impact on our overall physical health, our emotional health, our mental health. It's significant, which is why I love what I do.
Tune in next week for part 2 of this Completely Me podcast episode featuring Dr. Gracey. Thanks for watching. If you enjoyed that video, be sure to hit the like button. To learn more about child development, parenting, and the disabled world, make sure to hit subscribe. Also, don't forget to sign up for the Completely Me activity kits that your little ones will love. See you again soon.